Welcome everyone. I'm Dr. Sheldon Martin. I'm the head team physician for the Arizona Rattlers. I want to welcome everyone to the second annual ACL Injury Prevention Clinic. We're really excited about this year's clinic. We hopefully have a fun but educational day for you guys. We're going to spend some time up here talking about ACL injuries and what those are and why they're relevant to you. And then we're going to get you down on the field and we're going to take you through some of the exercise programs that we use to rehab players and athletes after ACL injuries, and also use to prehab, so to speak, and we'll kind of talk about what that means. So first off, before we get started, I want to thank the Arizona Rattlers for providing this great venue for us. I want to thank our co-sponsors, Spooner Physical Therapy, who have helped put this program together, and they're going to be coming up, some of their physical therapists are going to be coming up and talking to you guys about some of these different exercise programs. So I'll start off with just a short talk introducing what we know about ACL injuries currently in 2015, and then we'll have Tori, Ryan, and Pete come up and give you guys some talk. So first off, can everyone hear me okay? Okay, great. So as I said, I'm Sheldon Martin. I'm the team physician for the Rattlers, also take care of some of the other teams here in town. I am orthopedic surgeon. I specialize mostly in sports medicine and athletic injuries. I do mostly shoulder, elbow, and knee surgery. So this is what I spend a lot of my time doing, is ACL injuries and taking care of athletes that have ACL injuries. And so it's one of my passions, and that's why we're doing this clinic today for you guys, to try to prevent you guys ending up in my office needing surgery, right? So we'll just kind of start off here with the general outline. We're going to try to keep this informal. If you guys have questions any time throughout as we're going through here, just raise your hand and we'll answer them. But we'll basically start off with some general statistics and talk to you about why these injuries are important. Why do you care? Why are you even here, right? And we'll talk about what the anterior cruciate ligament does, its function, its normal function in the normal knee. We'll look at some mechanisms of injury. How do athletes and players injure their ACL? We'll talk about some of the predisposing factors that we believe lead to ACL injuries or put one person more at risk than another person. We'll talk briefly about, if you do tear it, what you can expect to happen if you have to come see me or somebody else that's going to take care of you. We'll talk about the treatment, and we'll look at the postoperative rehabilitation programs and also outcomes. So ACL, what's all the hype? So we see lots and lots of newspaper reports, and we hear about media talking about athletes that injure their ACL, especially these injuries are on the rise in young athletes, and so we see lots of newspaper articles and hear about, and you guys probably know people that have had ACL injuries, right? How many in this room have ever injured their ACL? So there you go. We got 1, 2, 3, 4, 5, 6. We have about 50 people here. So 6 and 50, that's about 10% of the room has had an ACL injury. How many had surgery? So the same 5 out of 6, okay? So 1 didn't. So that's about right across the population. So it's an ongoing problem. We have lots of very notable names that have had ACL injuries and pro athletes, football players, and of course RG3, who went through his ACL injury. So it's a big deal. It really is a major deal. If you look at the statistics, 250,000 ACL injuries a year across the United States. Since this tends to be a surgical injury, or an injury that we treat primarily with surgery, most of those are surgical, as you saw just in this room here, 5 out of the 6. That leads to about 200,000 ACL reconstructions a year. So 90% of these occur with sports injuries, okay? So these are not injuries that you occur by going up and down the stairs or just walking to and from school. These happen while you're playing sports. And 50% of these injuries are in your age range, okay? 15 to 25. So this is the population that it affects: high school, college, and young adults. ACL reconstruction is not a cheap surgery, right? There's a lot of expense acquired, and thankfully, you know, your insurance takes care of most of that, but sometimes it doesn't, especially with more costly insurance. As we go forward, the insurance, your healthcare insurance becomes more expensive. So average rate of return to sport after ACL injury or after surgery is 6 to 12 months, so it takes a long time to get back to playing your sport. There's a 6% re-tear rate of the same knee and a 12% re-tear rate of the other knee. So it's not 100% effective surgery. You can still re-tear it even after you've had surgery. And if you look at the 6 and 12% is for all comers, right? So those people that don't go back to sport are included in that 6 and 12%. But if you look at just the people that actually go back to play the same sport, it's actually higher. It's greater than 20% re-tear rate. So let's talk about the anterior cruciate ligament. What is it? So if you look at this diagram here of the knee, you see the femur bone here, the tibia bone. This forms the knee joint. Here's the kneecap or the patella. The ACL goes from the femur down to the tibia, kind of obliquely across the joint. And so the ligament behind it is the PCL, or the posterior cruciate. So anterior cruciate just means the one in front. The posterior means the one in back. And they're called the cruciate ligaments because, as you can see, they form an X or a cross. And they're very important, as we'll get into in a few slides, for rotational control and also anterior and posterior, or movement and forward and movement backward of the tibia and the femur. There are other structures in there as well that are important. The meniscus, which you see here, these are C-shaped cartilage rings that essentially act as shock absorbers between the femur and the tibia when you're doing impact activity. So what does it do? So as I said, if you look at this cartoon here of this skeleton as it's moving forward, and so as you're walking, the tibia wants to move forward because of your momentum, but there's also internal rotation, or rotation of the femur on top of the tibia. So it's not just a front and back plane, and the Spooner guys are going to get into this a lot with you, but there's a rotational component, and that's what the ACL does. It stabilizes. But the thing to remember is that there are a lot of other structures in the knee as well, not just the ACL. Out here on the outside part, called the lateral part of the knee, you've got a ligament as well. That's the lateral collateral ligament. You've got the PCL, or the posterior cruciate ligament, in the back. That also helps with translation. You've got the medial collateral ligament over here on the inside, and that prevents the knee from kind of buckling out. And then again, you have the two meniscus. So you've got a lot of structures inside the knee, all of which can be injured at the same time you have an injury that tears the ACL. And here you just see the two cruciate ligaments, how again they form an X, and you can imagine that without those you're going to have a lot of rotation in the knee that you don't want. And so that's what the ACL and the PCL do. They help prevent that rotation, excessive rotation of the tibia in relation to the femur. So that gets pretty deep into kind of the physics of what happens. Let's look at this in live motion. You know, what does this look like when the knee is moving? So here you see the knee bending, flexing and extending, and that's basically a hinge type motion, right? Just like a door opening and closing. But if you kind of focus in on the knee and you really break it down, there's actually a rotational component involved there as well. It's not, the knee doesn't just flex and extend, there's some rotation, especially in combination with weight bearing. So when you put the foot down on the ground and your weight's going through the leg, there's even more rotation involved there. So as you're running, you're flexing and extending, but you also have this rotational component. And so as you see here, there's a lot of force going through this guy's knee every time he plants his foot down on the ground. So let's look at some of these mechanisms in real life. So we take that kind of mechanistic idea there in the cartoons, and let's see what it looks like in real life.
New territory for the Cardinals as they start the second half of the 2014 season, looking to go 8-1.
Okay, nice to meet you. All right, let's go to work. Here we go. John one. 3 down. Mike 5-2. Let's go. Mike 5-2. Righty, righty. Let's go. catch by Michael.
Play fake back to Palmer. Drilled, sacked.
You listen in, talking, Gary. Come on now. And off you. And the end zone, there's going to be some water. Let's go.
Palmer takes, pitch to Ellington. Running left, cuts right, and will walk in the end zone for the touchdown.
Great job. So go.
All right, so watch closely.
Carson Palmer is hurt. Oh boy, looked like a non-contact injury. He's writhing in pain.
Foot hit the grass gave, and
Right there, you saw his left knee, his leg kind of buckle.
ACL gateway. Felt it right away, knew right away.